irrespective of their age. Certainly when they're over 65, I can't tell you, 4 out of 5 people don't have a clue about it. And the other thing I'm hearing too when I talk to companies is that they haven't really given much thought to their Medicare eligible population. If they stay working, they just tend to just stay on the company plan and never look at Medicare as an alternative. So I want to just address the two, just very, very briefly, real overview. Medicare, as you probably know, is essentially a federal health insurance program for people over 65, and there are some people under 65 who have disabilities, who are also eligible for it. But I'm going to really focus on the 65 and over population. It's not Medicaid, it's Medicare, okay? And there are 2 ways that people get Medicare. Most people are familiar with Parts A and B. That sort of sound familiar. That's kind of the original Medicare, okay? A covers your hospital, B covers your doctors. And then and Medicare was designed to cover approximately 80% of the cost of care. So what do you do for the other 20%? So a lot of people take out what are called Medicare supplement plans or Medigap plans to cover all or a portion of the difference. And then starting in 2006, I believe it was, they added the Part D prescription drug coverage. So a lot of people on Medicare will have Medicare Parts A and B, cover the bulk of it, the supplemental plan or the Medigap plan, or they'll have, and their drug coverage. The other way, totally different way to get Medicare is through Medicare Advantage plans. And those are private plans. Those are plans that are offered by healthcare providers. And what happens is you get your Parts A and B as well as your drug coverage and your supplemental coverage in effect through the Medicare Advantage plan. And the way it works is that the Part A and B, and this varies by where you live, your locale, the government, Medicare, essentially pays a premium each month to the insurance company to, in effect, cover your Parts A and B, because they recognize you're not coming to Medicare, so they give that stipend, if you will, over to the insurance company. So you can get all of your stuff through a Medicare Advantage plan. They typically work as HMO or PPO type programs. So if you think about it, they're really very similar to probably most employer-based plans in terms of the way they're designed. Most people enroll in Medicare when they're turning 65, but those who are still working have the option to stay on their current plan. So what will generally happen, and certainly for plans with more than 20 people, what will generally happen is that their Part A coverage is free, so they kind of automatically get that. Their Part B coverage, which is the hospital stuff, for which they're going to have to pay a premium of $105 a month, they can pass on that. They don't have to sign up for Part B if they're covered under an employer plan. In fact, they can wait until they leave the employer plan to sign up. There's certain sort of guidelines and timeframes and whatnot. I won't bore you with the details, but they don't have to sign up for Part B initially if they're covered under employer plan. Part B, as I said, Part B has a premium. Medicare supplement plans also have premiums. They're going to vary based upon your location and the plan choice that you make. Part D prescription drug plans have premiums associated with them, and Medicare Advantage plans have premiums associated with them. The Medicare Advantage plans, on a premium basis, tend to have lower monthly premiums than the Medicare supplement and the prescription drug plans, but once again, you're going to be kind of using a network of physicians, very much like your company plan. So you may pay, conceivably, you may pay less on a monthly basis for premiums, but you might have more of a copay under the plan. And once again, these are generalizations. Every one of these things is very plan specific. So I'm just trying to give you some sort of general overview. The basic differences between, it's not necessarily that one approach is better than the other. They just really work differently. So when I sit down and talk to people and try to explain to them how does Medicare supplement work and the drug plan and how does Medicare Advantage work, just understand that they're different, they work differently, and the major differences are things like in Medicare Advantage, there's generally a network of service providers. With Medicare supplement, even though it may have higher monthly premiums, any provider who bills Medicare will take your Medicare supplement plan. Medicare Advantage plans normally have the drug plans built into them, part of the premium. Medicare supplement plans don't. They're not a drug plan, so you have to buy a separate Part D drug plan. So very, very quickly, those are the, kind of the